I'd like you to imagine that you've won the lottery. Not just any lottery, though, the NHS lottery, by which I mean you have an actual appointment with a GP. I know. And you've got a health concern. Unlike all the rest of my patients, obviously, you've Googled it, and you're pretty confident that it's treatable. So you're expecting reassurance, advice, and hopefully living to a ripe old age. But imagine instead if I say to you, well, I could treat you, but it's tricky and I'm a bit pushed for time. So what I'm going to do is I'm going to diagnose your condition as terminal. I'm going to give you these pills to ease your pain so that you go away. And that way I can get on with seeing the next lottery winner. Would any of you find that acceptable? No? And yet, conversations like that take place every day when it comes to the one condition that we will all be affected by in our lifetime: loneliness. Now, loneliness is a mismatch between the quality and the quantity of the relationships that you have and those that you need. And it's generally considered that it may increase your risk of dying prematurely by as much as 30%, knocking years off your life. And it may be worse for us than obesity, physical inactivity, and other health problems. And so overall nowadays, it's possible that you may be more likely to survive cancer than you will loneliness. Now, your lifetime chance of being affected by cancer is about 1 in 2, same as your chance of being affected by loneliness. And in the UK right now, there are over 3.8 million people living with chronic loneliness, compared to 3 million people living with cancer. And in the case of cancer, survival is improving because we've got better screening and better treatment. In fact, some cancers have a 5-year survival rate of 90 to 100%. But that's not true of loneliness. And loneliness has this unfortunate double whammy effect because not only are lonely people more at risk of cancer, but you're also less likely to survive it. And loneliness increases our risk of other diseases, heart disease, strokes, mental health problems. But perhaps most cruelly of all, whereas cancer is primarily a disease of older people, do you know which age group in society are the loneliest? 16 to 24-year-olds. Just think about that for a moment. You may be elderly, frail, sick, bereaved, and yet still be less lonely than a young adult who's meant to be in the prime of their life. So how does loneliness cause disease? Well, when we're lonely, we feel unsafe. When we feel unsafe, our brain's control center's fight or flight mechanism goes into action. It presses the body's accelerator pedal, you get a cascade of hormones, and you get a rise in heart rate, breathing rate, and blood pressure. And it's an inflammatory process, so that if you are chronically lonely, you're chronically inflamed. And inflammation can affect any part of your body: organs, blood vessels, your immune system, even the genes, which in turn influence your risk of disease, including cancer. Now, in the UK, we've got screening programs for breast, bowel, and cervical cancer, and they save about 10,000 lives a year. But there is no such screening program for loneliness. But there could be. Now, there are validated research tools for assessing loneliness. There's the UCLA 20-point scale. There's the rather sadly named 5-point alone scale. But as it turns out, one question is just as good as many. And would any of you like to guess what that question may be? Do you often feel lonely? Now, this may sound like a bold question to ask. I'm not suggesting that you approach random people in the street to ask this question. You've got to take a targeted approach, asking it of the people who need it the most. And to do this, we need to understand the risk factors for loneliness and the signs and symptoms of loneliness. So what are the risk factors for loneliness? Well, not having close relationships or losing those relationships, losing your job, a change of situation, moving from one place to another, developing physical or mental health problems, or having a baby. And what about the signs and the symptoms of loneliness? These could include anger, social withdrawal, spending less time in activities with others, and more time by yourself online, on social media, self-neglect, or drug use. And there may be verbal cues as well. So people may talk about feeling isolated. They may describe actual aches and pains. And that's because loneliness activates the same centers in our brain as pain does. So being lonely literally hurts. So let's agree that loneliness is really bad for you, that it could be considered like a disease, and that maybe we could have a screening program for it. So how would we approach this? Well, the good news is that it doesn't require blood tests or expensive procedures or a medical qualification. All you need to know are the 3 L's of loneliness. Look, listen, and lend a hand. So look for people you know that are struggling. Their behavior may have changed. Engage them in conversation to show that you're more interested in more than just that typical superficial exchange of social niceties. Maybe build up to the loneliness question rather than starting with it. Listen to people tell you their stories. As a GP, I guarantee you that people will tell you all you need to know if you give them long enough, if you aren't afraid of silence, and you don't interrupt. And that way you get to find out what matters to people, not just what's the matter with them. An example is my son Luke. Here's Luke. He's my oldest boy. He has severe complex epilepsy and a learning disability. But perhaps most importantly, he is officially the world's most wonderful and inspiring human being. It's true. And he's got a really positive outlook on life. But during the COVID-19 lockdown, he really began to struggle because a lot of his connections were just severed. And he became socially withdrawn, anxious, irritable, low. And it took us a while to realize this. But when we did, we sat down with Luke and his carers, my wife and I, and we came up with a plan. And this was to help him re-establish his connections. And that was things like more family time, playing football in a football club, working at a garden centre, and singing in a choir. And gradually, it wasn't easy, but all these things gradually came back into place. He required a lot of encouragement, but we got there in the end, and he is now, once more, his happy and connected self. Now, Luke didn't require help from the NHS, but that doesn't mean that we're off the hook as health professionals. GP surgeries could ask a question about loneliness in the new patient registration questionnaires that we do. And we could target those at-risk groups, for example, older patients or young adults who've just left university and are starting employment, or maybe someone bringing their baby for the first set of immunizations. Now, before those of you who work in primary care get a little bit worried about this and start to imagine waiting rooms full of lonely people with Eleanor Rigby playing continuously in the background, I do have 2 words of good news for you: social prescribing. So social prescribing is a movement which is all about connecting people to the things that matter to them so that they can take more control over their lives and be supported in finding the right solutions for them. And it's a non-medical solution, which when you think about it makes perfect sense because most of what determines how well we feel in life happens outside of the GP consulting room and the hospital outpatient department. And the social prescribers are experts in the 3 L's. So they look, they listen, and they lend a hand. And they know all about the local organizations that could help you, charity, voluntary, faith-based organizations. They know all about the services that you could connect with and take part in, such as gardening or cookery clubs, groups for learning together, befriending services, debt advice, or support for carers. And the good thing about social prescribing is that anyone can access it. You can be referred by your GP, but you can refer yourself in as well. Now, some of you may be thinking, well, I'm still not sure about this. All this talk of loneliness does seem a little bit overwhelming. You know, what happens if we're opening a big can of worms, a lot of unmet need? How are we going to manage that? Maybe it would be better not to know. But ignorance is not bliss. And we can pretend that loneliness doesn't matter. We can stick our heads in the sand, stick our fingers in our ears, but when people's lives begin to unravel, when our lives begin to unravel, it'll be worse for us, it'll be hard to fix, and it'll be much more costly to the system as a whole. In fact, social prescribing is meant to help the NHS because there is now good evidence that it does exactly that. In a study done recently, people referred into a social prescribing scheme reduced their need for a GP appointment by 28%. And even more impressively, by their need to attend the accident and emergency department by 24%. And I can guarantee you, after a quarter of a century of practicing medicine, that there is no other intervention out there anywhere near as powerful as that. So I'd like to finish by asking you, what are you going to take away from this conversation today? Is it going to be the scary, attention-grabbing title, the scary statistics, or might it be about the 3 L's of loneliness and becoming part of a screening program and becoming part of the solution? Like death and taxes, one thing is certain: at some point in our lives, we will either be lonely or we'll be in a position to help someone who is. And in the words of George Bernard Shaw, none of us are self-made. We're all made up of the people who've helped us along the way. Thank you.